Hi guys, and welcome back to Navigating the Periphery. My name is Deborah, and this is my son Philip.
Hello.
We hope everyone is having a good day today. If you're into what we're doing on this channel, please like and subscribe below. We really want to get our message out there and try to reach as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
We are. So, Philip, how are you doing today?
I'm doing great today, Mom. How are you doing?
I am good and excited to discuss today's topic. Today we're going to navigate the periphery of the difference between intrusive thoughts of obsessive compulsive disorder and auditory hallucinations that accompany schizoaffective disorder and schizophrenia.
I'm excited to discuss this as well, Mom, because as a patient, I have personally experienced both symptoms with both disorders. Intrusive thoughts and auditory hallucinations are both distinct experiences, though they can sometimes be confused with each other due to their intrusive nature. Both can be distressing, but they originate from different processes and are associated with different conditions. Understanding these differences is key to appropriate diagnosis and treatment. As an 8-year-old child, I was diagnosed with obsessive compulsive disorder, or OCD. I experienced many intrusive thoughts and had many compulsions.
Intrusive thoughts are unwanted thoughts, images, or urges that can cause distress or anxiety. They are thoughts that the person recognizes as their own thoughts, even though they are unwanted and often distressing. Now, these thoughts not necessarily are voices in your mind. Individuals with OCD are typically aware that their intrusive thoughts are a product of their own mind. They may fear acting on these thoughts or worry that having these thoughts means something about their character, but they understand that these are thoughts, not external realities or voices.
People with OCD often respond to these thoughts with compulsions or mental acts to try to neutralize or mitigate the anxiety or distress caused by those thoughts. This can include checking, washing, counting, or performing certain rituals. For instance, I would count ceiling and floor tiles in school as a kid, which was very noticeable to other students in my class, and they would say things to me. Fortunately, medication really helped me with this symptom, so I was able to appear normal to the other students. As I got older, safety became more of my issue. I needed to check all the doors, locks, etc. everywhere all the time.
Now, auditory hallucinations are different. They involve hearing sounds or voices that are not there. An actual voice, which is very different than a thought. These can range from simple sounds to complex voices and are perceived as originating from outside the person's mind. They can be associated with a variety of conditions, including psychotic disorders such as schizophrenia, schizoaffective disorder, mood disorders with psychotic features, or neurological conditions. The level of insight can vary. In some cases, especially early in the course of an illness, individuals may not recognize that these experiences are not real. Over time or with treatment, they might come to understand that these voices or sounds are not actually present.
The auditory hallucinations that I experienced during the onset of my schizoaffective disorder were of conversations. I couldn't necessarily understand a lot of those conversations. They were of both muffled male and female voices. In the beginning, it happened a lot when I was driving and became so distracting that I had to stop driving my car. Some of the things that they said were, you need to get them before they get you. And they gave me directions/instructions to do things, like stating I am no good and not worthy, to self-harm and get rid of myself. At times, it was so frightening. I was so afraid. Sadly, this happened a lot while I was at my college campus, when I would see a flood of students walking around after classes would end. My mom started to notice that I was hearing things that were not there from how I was acting, and I thank God she did. I didn't know or really understand what was happening to me, and probably would have never told my mom what I was hearing or experiencing. So I am thankful for how observant she was, to even recognize that it wasn't just my OCD, and speaking about to myself, and when she did ask me if I was hearing conversations, I told her the truth, that yes, I was.
Responses to auditory hallucinations can vary widely, from engaging with the voices to trying to ignore them, to seeking medical or psychiatric help. Treatment often involves medication, psychotherapy, or a combination of both, which, after other medical diagnoses were ruled out, I took Philip to the psychiatrist and started his medication regimen immediately. And fortunately, Philip was already seeing his clinical psychologist and behavioral neurologist. People who suffer from OCD usually know that their intrusive thoughts are their own thoughts and not real, whereas the level of insight into auditory hallucinations can vary, and they might be perceived as real external voices, especially without treatment. Intrusive thoughts are most commonly associated with OCD or anxiety disorders, whereas auditory hallucinations are more commonly associated with psychotic disorders, though they can also occur with other conditions, such as what Philip was experiencing.
One of the first treatments for me was being put on an antipsychotic medication. Antipsychotics are divided into two main categories: first generation or typical antipsychotics, and second generation or atypical antipsychotics. Each has a unique profile in terms of efficacy, side effects, and mechanisms of action. We discussed this in our second episode on what is schizoaffective disorder. If you haven't seen it, please check it out below. Antipsychotic medications are the cornerstone of treatment for psychotic disorders, and can be very effective in reducing or eliminating auditory hallucinations. Like we stated in our earlier episode, there are various types of antipsychotics, and finding the right medication and dosage can require careful management by a psychiatrist.
The choice of antipsychotic depends on various factors, including the patient's specific symptoms, side effect profile, medical history, and responses to previous treatments.
Monitoring and managing side effects are crucial aspects of treatment with antipsychotic medications. It's also important to consider patient preferences and quality of life when selecting a medication. Continuous evaluation and adjustment of the treatment plan are essential to find the most effective medication with the least disruptive side effects for the individual patient.
There is also cognitive behavioral therapy, or CBT. CBT for psychosis is tailored to help individuals understand and change their thoughts and behaviors related to their hallucinations. It can also help with insight, coping strategies, and reducing stress. The first step for anyone experiencing intrusive thoughts or auditory hallucinations is to seek professional help. A qualified mental health professional can provide proper assessment and diagnosis, which is crucial for effective treatment. Also, educating yourself and others is vital. Understanding your condition and educating those around you can be empowering and can improve the support you receive.
Another aspect that is essential and vital to getting well is following your treatment plan. Attend therapy sessions and take prescribed medications as directed. Adjustments might be necessary along the way, but these should always be done under guidance of your doctors. My medication routine needed to be adjusted several times until it worked effectively, and now I have been on the same regimen for 18 months without any issues. Knock on wood. I know I will always need to take medication for my schizoaffective disorder, or my symptoms will return, and I never want that to happen again. During a stressful period last semester in college, I started to break through my medication. I started to experience little things that indicated that my symptoms were returning, and I told my mom and psychiatrist right away to tweak my meds to fix the issue before it became a real problem again. It is also important that if you don't feel right, to let your physicians or people close to you know.
Also, connecting with others who understand what you're going through, whether through support groups or online communities, can provide additional emotional support and coping strategies, which is why we started this channel. Philip and I know that support is so important, and some people, patients, and parents don't know where to turn. I was fortunate being in the medical field. I knew where to turn and who to call, but many patients and parents do not, which is why we wanted to start this channel and help those people.
So we hope this episode helped clarify and explain the differences between intrusive thoughts and auditory hallucinations. It's essential to approach treatment with patience, as finding the right strategy and medication regimen can take time. Finding the optimal treatment strategy is often a process of trial and error, involving careful adjustments of medications, dosages, and therapeutic approaches. Patience, perseverance, and a proactive approach to treatment can make a significant difference in managing psychiatric conditions.
So thank you guys so much for watching this episode. Please remember, it's okay not to feel or be okay all the time. You are not alone. We are here.
So please leave your comments and thoughts below. And thank you everyone so much for watching on Navigating the Periphery, where we're trying to stop the stigma of mental health one show at a time. Please take care, have a great day, and we'll see you in our next episode coming really soon. Take care for now. Bye.
Bye.